Welcome back to the Healthy Business Podcast, where we can be heard on Apple Podcasts, Stitcher Radio, or Spotify. I want to thank Jeff Krushka one more time for the previous episode interview. He is the director at BS&P CPAs, and we got a lot of attention on the topic of the PPP, the Payroll Protection Program, and got one of the reporters from Buffalo Business First listening into the podcast, Dan Miner, and he was so interested in the topic, he ended up doing a write-up on Jeff Krushka. So I'm glad to see that Jeff got even a little more attention after the podcast. Next up, we have Dr. Domenic Berardi of Berardi Dentistry. And dentists used to have one of the most safe and stable occupations, but post-COVID-19, they are now ranked 3 occupations out of 4. 3 of the top 4 most dangerous occupations are in the dentist industry. Dr. Berardi is going to tell us more about that and the future of dentistry and how it's going to affect you. So, next interview. I hope you enjoy. Have a great day. And remember, always support the small businesses out there. They need your help. Okay, I'm here with Dr. Domenic Berardi. He's the owner of Berardi Dentistry. Dr. Domenic, thanks for coming in. And if you could first just tell us a little bit more about yourself and about Berardi Dentistry.
Well, you're very welcome, Tony. Pleasure to meet you. I know you've talked to my sister, and
yeah,
speaks highly of you. So I hope we have a nice conversation.
We got a family of entrepreneurs.
Entrepreneurs. I'm a little older than her, about 4 or 5 years. So I've been out of dental school. I think it'll be 27 years next month. So I did something back in 1990. I got out in 93, did a year residency. So in 94, I did something a little unusual even for back then. It's highly unusual now, was to start a business from scratch in the dental field. So I had a good friend that I did my residency program with, and we decided we were going to open up our own practice. Now, whether you're in dental school, medical school, optometry school, there is no business education. So, it's baptism by fire. So you get 2 young guys, you walk into the bank and you say, hey, we want to start a dental practice, a business. So they were very eager, unbeknownst to us, to lend us money, and we thought, hey, these 2 young guys, we don't have 2 nickels to rub together. Came up with a rudimentary business plan, and they were very willing through the SBA. So I've dealt with the SBA before to loan us some money. So long story short, filled out the application and scratched my head and said, why are you guys so eager to loan money to 2 guys that have nothing but student loan debts? And they said, well, dental offices don't fail. Okay. So they handed us a check for, I think it was a couple $100,000. And we had already done the numbers. We knew what it was going to cost, as far as our rent and equipment and startup costs. The big problem was when you start a business from scratch, like a dental office, you have no patience. Okay, you have no customers. So here we are in this nice new office, and now we have to put on not just the dentist hat, we have to put on the entrepreneur hat. How do we bring people into the practice? So the first couple of years, it was a little disheartening. I remember after the first year, my business income was minus $14,000, and I thought to myself, geez, I always heard that dentists make a lot of money and live this great lifestyle, and here I am, in the hole of 14 grand. Now, fortunately, we both had wives that had business degrees and were working, and some income coming in. We also did other jobs. We were working, in the dental field. We weren't, picking fruit or anything like that, but we were working for the county health department, part-time in other offices. So just to keep money coming in for personal finances, we did that until our business grew a little bit. About 3 years in, we bought a practice, somebody else's practice, which is more typical of what someone would do if they want to get into the dental field. So there was a dentist that was retiring. We bought his practice, and all of a sudden we had an influx of patients, which helped tremendously. After about 5 years, we kind of split ways amicably. We're still pretty good friends. We were kind of going in different directions business-wise, and we had the practice set up where it was 2 separate practices sharing the space, so it wasn't too hard to break apart. That was in late 99. I moved to my current location on Worley. I ended up purchasing a business condo and moved over there. And I've been there for just over 20 years. Along the way to grow, through natural growth of referrals and a little bit of advertising and marketing, I've purchased another 3 or 4 practices of retiree dentists along the way. So that's a really good way to build your patient pool up and get an influx of customers. So as the business grew, I added employees. Fortunately, my wife is an accountant. She has an accounting degree and she has an MBA. So I always lean on her. And right now, she pretty much runs the show financially. After our youngest started kindergarten, which was, she's 18 now, so it's been quite a while. I kind of talked her into starting to work for me, and incrementally over the years, she's picked up a bigger role. Right now, she runs the business, where it's taken a big load off of me. I can concentrate on what I want to do, what I like to do, which is practice.
That's great. Yeah, that's great. Before the COVID-19 crisis, how many employees did you have, and what adjustments have you had to make while we're in this crisis?
Well, currently, I still have everybody employed. They're all on, aside from my wife, they're all on unemployment. I have 8 staff members between front desk workers, assistants, and dental hygienists, and then I have another doctor in my practice part-time who's a dental associate. So fortunately, she's been able to work. She has another part-time job in a health clinic setting, so she's been working a little bit. So at least she has some income coming in. But everybody else is on unemployment, and it's a sweet deal with the extra $600 a week. So a lot of these are really eager to come back to work, So I shouldn't say that, but I keep in contact with them. I'm trying to keep everybody engaged and up to date. The healthcare scenario right now seems to be changing. It's not even day to day. It's almost hour to hour, and a lot of speculation out there. And right now, that's pretty much what it is, speculation. I don't think anything concrete has come out yet. There are some big hints of what things will look like medically and dentally that make sense, but there's a lot of wild stuff out there. And you know how in a crisis, the vultures come out and people try selling you products and gimmicks. You're going to need this, you're going to need that. And we don't know exactly what we're going to need yet. So, my advice talking to my colleagues is let's be patient here and let's see what the official recommendations are from the American Dental Association, the State Department of Health, before we get out of control with, what we need versus reality, what we're going to need.
Yeah. So let's dive into that a little bit, because dentistry sounds like it's far more hazardous than it used to be with COVID-19 around and no vaccination or anything like that. So let's assume we all can get back to work mid-May, early June, something like that. What adjustments do you see immediately that you're going to need to make, and then let's dive a little deeper into maybe longer term.
Sure. Well, first of all, OSHA came out with the OSHA pyramid, and the bottom of the pyramid was low risk. Then you had your moderate risk, high risk, and then very high risk professions. Dentistry was considered very high risk. I think there were 3 others: respiratory therapy, anesthesia, anything that you have to engage the oral cavity and have a breath or cough come out is going to be high risk. So of the 4 professions that are the highest risk, number 1 was dental hygienist.
Wow.
Number 2 was respiratory therapist. 3 was dental assistant. 4 was dentist. So we have 3 of the top 4.
Wow.
And the reason is, if you've been to the dentist, which I'm sure you have, when you open your mouth and I start my drill, it engages water into your mouth and air, and it releases a vapor, a mist. So a cloud of potentially hazardous vapor into the air. When you get your teeth cleaned, a lot of times the hygienist will use an ultrasonic cleaner. That even releases more of a vapor. And the problem on the dental hygienist end, they usually don't have an assistant with them. They're usually working solo. At least with me, I have somebody suctioning with a high-powered suction some of that mist, where they don't. They have a little saliva ejector, we call it, which is about half the suction power. So they're going to release more of this vapor in the air. And the problem is, it's going to move throughout the office. So the question is, how do we contain that? How do we protect ourselves? How do we protect our patients? How do we protect people in the waiting room? So it's a big problem. There are some things that we've done in the past. For instance, you came in for a cleaning, I can have you rinse your mouth with some Listerine. There are some prescription strength rinses that would lower your bacterial load in your mouth. And then when we cleaned your teeth, we would release less bacteria in there. This is a virus. So there are some treatments that are being recommended that are pretty inexpensive. Some concoctions of rinses that may reduce the viral load. Things that look very promising that have been used in Japan and Germany, almost like a standard of care there. And I think it's going to happen in the U.S. The big problem that I see is, if on May 15th they say, hey, turn on the lights, everybody go back to work, whether it's in the hospitals, your medical office, a dental office, there's no PPE. So,
and PPE, just for people who don't know.
Right. It's personal protective equipment. So your gloves, your masks, gowns, things like that. The standard is going to change. So when you go to the doctor now, or you go to the dentist, ordinarily I'll wear lab coat, a mask, gloves, obviously. Gloves came into the picture. You're probably old enough to remember as a kid, the dentist didn't wear gloves. Mm-hmm. So I think that was 86. So when I started dental school, it had just come into play, gloves and masks. So that was during the HIV crisis. So fast forward 30 plus years, that's still the standard of care. Wear gloves and masks and usually eye protection. But now, they want the N95 mask, which there seems to be in the last week or two a little bit more of a prevalence of it. So I think there's manufacturers out there that are really cranking the production lines up. Face shields, you're going to see almost like a welder style face shield, probably a bouffant type hair thing, gowns, and this. I keep using the word speculation. I even wrote it down on my notes in big capital letters. There's a lot of speculation on how to evacuate that mist I talked about a couple of minutes ago. The practicality of turning every room in my office into a surgical type suite that you would see in a hospital, it's not practical. I don't think you can ask every dentist in the country to snap your fingers and turn a room into a negative pressure room like you would have in an operating room. I think it time-wise would take a while because the equipment isn't there. B, the cost of it would be astronomical. And of course, in the business setting, that's going to be passed on to the consumer. And then C, it's educating us how to perform that particular procedure under, these new guidelines. So, what we're scratching our head about is, okay, well, for medicine and dentistry, the way insurance works, this is kind of a whole topic. If I could just touch on it real quickly, we sign up for insurance plans, and it's much more prevalent in medicine. Just about everybody's covered in insurance. Dentistry, it's about 50-50. But, the reason when you go to your doctor now, you get that 10, 15-minute visit versus, or sometimes it's even quicker than that. Sometimes it's like a lightning round, is because, they've signed up with your insurance, which, I'm not vilifying every insurance company, but, it's a lower reimbursement rate than what you would normally take. The guarantee is, well, sign up with, we'll say, just Independent Health. We'll provide you with a pool of patients at this lower rate. So to make it work, you have to look at your numbers and say, well, I was taking my regular fee, I can see 4 patients an hour. Since I'm taking half of what I would normally make and my expenses go up and the rate stays the same or sometimes even lowers, it becomes a treadmill. So now I have to see 10 patients an hour. So it kind of works the same way in dentistry, where when we sign up for an insurance company, we see the rates never increase, our expenses increase. So, when we go back to looking at changing our operatories into these surgical suites, we have to think, geez, on the bottom line here, can I make this work? Yeah. Can I take this fee and have, an extra, $7 to $10, considering PPE, if I add extra suction and vacuum systems and aerosol cleaners. Who knows? It could be an extra $30, $40 per patient. And then, the extra time, can I make this work? And that's kind of where we are right now. There's a big upheaval. There's a lot of confusion amongst my peers and colleagues. We just don't know how this is going to pan out. My guess is, in the end, as the dust settles, practicality always comes back into play. Once you implement things, it's hard to reverse. It's hard to reverse this. So if they want us to wear hazmat suits and, turn our ops into surgical suites, when this virus is not as threatening, what do? Do we reverse that? Probably not. You're in business. That usually does not happen. So going forward, I think at the end of the day, with any business, any kind of change gets dumped onto the consumer. So I would look for costs to increase. It's going to cost me a lot more to provide the service, so the patient is going to end up absorbing that. So it's not going to be good. It's not going to be what you are used to. If that answers the question. That was a long.
Yeah, no, thank you. That was very helpful. Thank you. Basically, what I'm hearing is that the whole dentist industry is being turned upside down, and the business model is going to change.
Totally different business model. Different business model.
Yeah,
I can see, maybe looking at insurances and saying, I can't do this anymore. You can come to my office with your insurance. You may have to pay my fee, and we'll submit, and you'll get reimbursed at home. That may be something that more and more offices will have to look at. I don't know. If it comes full circle where the PPE is more readily available and the cost of it comes down, I doubt that'll happen. But if it becomes more efficient and we don't have to turn our room into surgical suites, where we just have to be a little more cautious, maybe take an extra few minutes wiping things down and making sure the rooms are a little more sanitary, then perhaps the death blow isn't, we'll call it that, the punch in the stomach isn't that deadly, and we get back to a more normal flow. The thing with dentistry, which I think, which is why I got into it, separates us from medicine. We're doing surgical procedures, even though it's a filling, it's a surgical procedure in the office, and it's a little more intimate in the relationship you have with your customer than you do with medicine. I spend a lot of time with my patients over the last 25 plus years, where we can have conversations like you and I are having in the dental office. And how does that happen when I'm working in somebody's mouth? You'd be surprised it does happen. But there's time for the back and forth, and you get to know people. It's more intimate. It's more intimate relationship than with your endocrinologist or your ENT. So to change that for us, gowning us up like a hazmat worker and scaring the heck out of everyone, it's really disheartening, because I don't practice like that. I don't want to practice like that. It's not that I'm saying I don't want to follow guidelines to keep everybody healthy, but I think part of the reason people come to me is that, and my staff, we engage you as an individual. Hey, how are you? Not just, let me look at your teeth. It's how are you as a person? We talk about your health, your family's health, everything from sports to lawn care. We really have a nice time, and I don't want to lose that personal touch. It really means a lot to me, and that scares me more than anything. I don't want a car wash assembly line type business. So I hope
that's interesting. Thank you for sharing that too. It appears, just to kind of go back to where you started with when you started, and the bankers were so free to just give you that money.
Yeah.
It might be the absolute opposite now. It could be one of the most risky businesses for a banker to invest.
Right.
That is interesting. Now, not only do you have to deal with just easing the fear of a customer of coming in for a cleaning, what have you, but your employees as well, and I'm sure that'll be a struggle. How much how much time have you had to think that through, or perhaps to talk to some of your employees about that?
I've had quite a lot of time now. It's been 5 weeks. I've contacted all of them individually and as a group, and I try to keep everybody abreast of what's going on. And they're doing their due diligence too. Everybody's kind of nose to the grindstone, ear to the speaker, I should say, trying to watch and listen to things that are being proposed. And, we know as a team, we're going to have to attack this from the front desk back. The last couple of days, interestingly, I've heard, you'll hear this acronym, POC, point of contact. There's some testing that they're trying to develop where if you were to walk in my office, I can quickly test you, have a staffer do it, quickly test you to see whether or not you're positive or negative for the virus. If you're negative, come on back. I hope it's business as usual. If somebody's positive, of course, we'd have to refuse or reschedule treatment. That seems to be, like I said, in the last couple of days, and this is changing hour to hour, where there may be some segue into a more practical or realistic solution. And if that's the case, I think for staff members, it's going to ease a lot of tension. They're just as scared as the patients. Of course, when I shut down, I did it about 24 hours before it became official. The ADA came out on a Monday night. I think it was March 16th. On the 15th, on Sunday, I was talking to one of my best friends who's also a dentist, and we decided, going back and forth, that, geez, this is getting out of hand. We knew we were in a high-risk field, and the question was, if we stay open, and I get a phone call next week from a patient saying, hey, I had my teeth cleaned by your hygienist, and I've come down with coronavirus. I would have to, first of all, tell my hygienist, hey, Mary Sue, you cleaned your teeth last week. She's positive for coronavirus. You're going to have to go into isolation. We're going to have to go into isolation. And now I have to contact every patient who was in the office that day. They're going to have to go into isolation. So this snowball effect was just overwhelming mentally. And I didn't want to put anybody in that situation. It was not worth it. I mean, unless it was a really bad dental emergency, your cavity that you have today, and I'm not trying to downplay dental caries or dental disease, it's going to be there in a couple of weeks. Your teeth being cleaned, if we had to wait a month, it's not the end of the world. I mean, I'd rather put that off and concentrate on your overall general health. So I thought that was more important. So I closed down that Wednesday morning, and I called everybody into the break room, and I said, look, here's what we're going to do. It's Monday morning. We're going to see the first few patients, but I'm going to have the front desk staff start calling people. We're going to start canceling. And a lot of them looked at me like I had, horns growing out of my head. And I explained why, just as I did to you, why it was important. Because I figured, if this doesn't come down from a top level down, and we're left on our own to do this, there's no end to this. You wait the 2 weeks, you come back to work, you start working again. Maybe I come down with it. Then it's the same thing. Everybody has to isolate. There was no good end to this. So I think the right decision was made. I think we had to take a little bit of a pause. The problem now is getting back into the swing. Again, where do we get the necessary PPE, and how do we restart these businesses that have, and that's not just dental. I mean, it's everybody. How do you restart your business where you've been sitting for, it's 5 weeks now. May 15th, it'll be 8. I have a feeling some businesses, maybe some office type work will go back. But, in dental, if we're high risk, we're not going back on May 15th. It's right. Especially in New York State. It's not going to happen.
Right.
So if it's July, I mean, we're talking, how do I accommodate patients that have been sitting for 3 months along with the ones that are already there? So we have some strategies and some ideas. There have been some really good national webinars. There are some groups that keep everybody involved. They've been fantastic. So we'll get through it. It's going to be an extremely difficult challenge. And at 52 years old, it wasn't what I was thinking was going to happen in my profession.
Yeah.
But, I can also see um, some docs, if they're in their 60s and 70s, maybe just saying, you know what, I'm done.
Mm-hmm.
68 years old. I'm doing it for the heck of it right now because I enjoy what I do. I love my patients, and I'm out. So that's going to be a challenge for the younger dentists. I think even more so. They're just starting out. A lot of student loans to pay off. They're getting married, buying houses, starting families. That's a bigger problem. At least at my age, those of us in our 50s and early 60s, we're kind of settled in. So, it's not a tremendous death blow. It's just, it's a big speed bump that we're going
Yeah,
to have.
it sure is. Because I can think through different scenarios where one, uh, customers won't want to come in just for the regular cleaning because they're afraid,
They're afraid.
which means then they're only going to come in when they have a cavity or when it's
Right.
really hurting. I could also see, to your point, people who just want to shut it down because it's now too expensive. Owners want to just shut it down, and now we have this shortage of dentists and and all of that, and it'll be interesting, I guess, to see what the new normal is.
Yeah, it's an evolving problem, evolving situation. Um, water always runs downhill, and it's going to wash some stuff away, but we'll get through it. I mean, ultimately, there are enough dentists in the area. This area has a high density of dental professionals. We have a fantastic dental school at UB, and a lot of people end up for whatever reason, when they're in dental school and they come into Buffalo and they're not from Buffalo, they diss Buffalo and they don't like Buffalo. You'd be surprised how many people stay in Buffalo. So a lot of especially downstaters, find it more affordable, more family friendly. They like the people and they stay. So we have a high level of dental professionals here. Actually we're blessed. There are just some fantastic dentists in this area. Some world-renowned dentists, and I don't think the average Western New Yorker knows that. But we're really in a good situation in this area. The school's fantastic. It's a high-level research institute, and it cranks out just great dental clinicians. I can't say enough about it. So we're really in a good spot, and it'll work for us. It'll work for us.
Well, that's good to hear.
Yeah.
That's good to hear, and it just might really work for you. I mean, as you had mentioned, I interviewed your sister Rosanna. You have a father who was a business owner as well,
Yeah.
and you guys are very entrepreneurial. And there's going to be a lot of opportunities with all of this change going on. So, this might actually work out for you as an entrepreneur too.
I think in the end it will. Part of the reason I got into dentistry was, my parents were hairdressers. I don't know if she told you that. And I saw the relationship they had with their customers because back in the 70s and 80s, as a kid being in that shop, women used to get their hair done a couple times a week. It's not like now where you get your hair cut and you don't come back for a month or two. They used to get the fancy hairdos with the hair nets, and so they would see these people quite regularly, once or twice a week. So they really had a nice relationship with these customers. And, as a kid, I didn't, you don't realize that until you get a little older. So when I was in college, as a bio major, I wanted to do something with bio. I love science. So I thought, how can I merge the entrepreneurial aspect of it, do what my father and mother do, and have a intimate relationship with people, but still be a scientist. And dentistry just seemed to be the merging of the two, a great mesh, and it has been. So I've kind of followed up, and I do a lot of the things that my dad. My dad was hysterical because he retired in 2006. He sold his business and closed his shop, but he rented a chair from another hairdresser because he still had this faction of little old ladies that were very reliant on Tony to do. He was also Tony to do their hair, and a lot of them at the time were widows. And what he would do is he would go and pick them up at their house, drive them to this shop, and sit them in this chair he rented, do their hair, and take them home. So I mean, I don't really plan on doing that with, I'm not going to pick you up and clean your teeth. But I just thought, as a business model, my God, how much, think about it. How much more personal care can you get?
That's great service right there. It's about as good as it gets. He
did that until my mother my mother was ill, until the point where he had to, pretty much take care of her 24/7. But it was hysterical. And, to kind of close on that thought, some of those elderly ladies became my patients. And I remember just a couple of years ago, there was a woman who was my dad's customer for like 50 years. And she ended up in an assisted living place, and he hadn't seen her in a while, but she was coming into my office because a lot of the nursing homes will bring patients to me. They'll have a service that, can deliver them, and we're handicap accessible. I can bring a patient right in with a wheelchair, so it's no problem. Well, he had come in that day for a cleaning, and she was there, and he hadn't seen her in a few years. And I tell you, my staff was in tears. It was something to see this reunion of people who had this intimate relation that was based upon a service. It was a business service, So it was really cool. And I keep that in the back of my mind when I treat my patients, that, the relationship my parents had with their customers is kind of the same thing I have with mine. And that's probably the thing I'm most proud of. I mean, I consider myself a good dentist too, but I think I deliver a little bit more personal care than a lot. And I think that came from watching my parents, over the years.
Excellent.
And,
that's a great story.
Yeah, it is a cool story.
Thank you for that. That is a good learning as well for any business owner. I mean, it really comes down to service, great service, and ultimately that's how a business will thrive.
Right.
2 more questions for you. Quarantine. Yeah. We're all quarantined right now. Who are you quarantined with, and how's that going for you?
Okay, well, I have 3 children who are all college age. My eldest is he's a doctoral student in polymer science at the University of Michigan, and he's come home. He's been home for about 5 weeks, and I tell you, this poor guy he's like a caged animal. He's been in his old bedroom, itching to go back to school. And I have 2 others. I have my second eldest is a senior at Canisius College. He's graduating. He's not having a graduation, so kind of feel for him. And then my daughter's a freshman at Canisius College. So they've all been home doing the online learning. And my wife has been running the business. So we have our business phone forwarded to her cell phone. So if anybody calls, they get my wife, Maria. And I tell you, she's been fantastic. She's actually taken the ball and kind of run with it. We've had an opportunity now for 5 weeks to, what do we do to make our business more accessible, more vibrant when we get back? And we're the process of redoing our website. So, I'm sure you've had to do this while you're working. It's not an easy task. So to have this little bit of cushion of time, it's a curse, but it's also been a blessing. We've been able to do some things and restructure to make ourselves a little bit better. So we've all been together, and it's kind of worked out. I mean, it's nice. I don't think I'm ever going to have a time where I have the 5 of us together in this house again. So, we're all eating dinner together. When I go to bed at night, I don't have to worry about, all right, it's midnight, who's not home, looking in the bedroom, waiting for the door to open. And, you sleep with one eye open when your kids are older. So I haven't had to do that. I've been sleeping better. It's been good.
I am enjoying it as well. I thought for sure, because I have 3 kids at home too, all older and college age and all that. And I thought for sure that we'd be all dead by now, and it wouldn't be COVID-19 that did it.
Right.
And I'm
bunch of crazy Italians in the house.
But it's actually, we're talking more than ever, which is wonderful.
Right. Yeah, it's been fun.
Now, you had mentioned that you're doing what you're doing with some of your spare time, but to go a little deeper in that, now that we all have a little spare time at home, what are you doing with it? What are you watching? How are you spending it?
I don't watch a lot of TV. I haven't been a Netflix junkie or anything like that. I do watch TV, but I tend to, maybe an hour before I go to bed, that's when I unwind. So I've been extremely busy. I mean, there are things, as an entrepreneur that they're always on the back burner, and I find myself like yesterday juggling 4 or 5 different little things regarding my business. So, I've been trying to do that. I really enjoy exercise. I'm doing a lot of exercising. In fact, my wife is good. She's sick of hearing me say this, and she's not around, so I'm going to say this. I haven't been this weight since high school. Okay, nice. And she keeps telling me to shut up. But exercise every day. I'm moving around a lot more. And, the weather hasn't been that great, but, I like to get outside and do things in the yard and the garage and stuff like that. So I've used the 5 nice days in 5 weeks. I've maximized them. So I've kept busy, in and out of the house. So it's been like a nice, I don't know, is this going to be what retirement is like? I mean, I don't know. It's not horrible. It's what you make of it.
Yeah,
and
right.
If you want to, and just flick a channel all day, I mean, that would get boring. But, I read a couple of books. I've watched some things on TV. So, I've kept really busy.
Good for you. Good for you. You're making the most out of it. If somebody wanted to be a patient of Dr. Domenic Berardi, how would we get a hold of you?
Well, right now, the best thing to do is call the office, 633-2327, or, go through the website, BerardiDentistry.com.
Look at, they're calling already.
They're calling already, yeah. Our home number. Nobody ever calls the home number. I don't even know why. It's usually a telemarketer, but that's the best way. You mentioned a few minutes ago about people being apprehensive to come back, and at least on our end, my wife has talked to dozens of our patients, and it's funny because a lot of people want to come in right now. Like, I can't get my teeth cleaned, and there are a lot of them are elderly patients too, which you would think that they'd be the most apprehensive. So, but we have had a few that have questioned, and I think that the point you brought up before is going to really factor in. There's going to be a segment of the population, not just in my office, they're going to be a little fearful to go back to the dentist, and I can't blame them. I can't blame them until the dust settles. Fear is the currency that the media loves to play with, and I by no means am downplaying the seriousness of this virus, but when you look at the numbers, I mean, the denominator of this, if you've watched over the last few days, has really grown. I mean, there have been tests out, and I think USC did a test where they found that 4% of the population in LA County has antibodies. So that means hundreds of thousands or even millions of patients or people have had this been exposed to this bug. So I think as we see that, it's not as deadly as we first thought, and the dust settles, people will come back around. We just have to make sure that we provide an area that's safe, an environment that's safe for not just our staff, but our patients, and they can get the services and the healthcare that they need. Every doctor's office, every hospital, aside from, COVID patients, has been closed for the last 5 weeks. So people aren't getting chemotherapy. They're not getting, what they deem elective surgery. A lot of these cases, if you're not getting an elective surgery, that turns into a serious health problem. I mean, it could be a bypass. It could be a stent for an artery. So the repercussions down the line of these people becoming chronically ill or even having fatalities, it's something we're going to have to look at. And I know that, a lot of talk about how to reopen and when to reopen that's really come to the forefront. So I hope, we do this in a practical, common sense manner, but these problems are going to have to be addressed sooner than later.
Yes. Yeah, I agree. Well, Dr. Domenic Berardi, owner of Berardi Dentistry, thank you very much for coming in. That was a great interview and gave us a lot of great information.
It's a pleasure meeting you.
Pleasure meeting you too. You take care.
All right.